Hey there, Mama. Are you currently pregnant or breastfeeding and concerned about the Cyclospora outbreak? If so, this video is for you. My name is Dr. Jessica Poland. I'm a maternal fetal medicine physician and mother of four here with Femme MD. Today, I'll walk you through what you need to know about Cyclospora, things you can do to decrease your risk of actually getting it, what to do if you get it, and long-term outcomes for the baby. So let's start first with what is Cyclospora. Cyclospora is a parasite and it's transmitted via fecal-oral route, which means stool is infected with the parasite and somehow that stool material gets into your mouth. Typically, this is either you drink water inadvertently, like maybe at a swimming pool that has stool in it, or more recently, the vegetables that we're eating are somehow contaminated with stool from water that's used for irrigation or washing or something. So Cyclospora during pregnancy, there is good news, which is it has not been linked to any sort of birth defect or congenital problem for the baby from the parasite. The parasite does not cross the placenta. The bigger concern during pregnancy is your health. So if you do not treat Cyclospora, and if you get very sick, you can have diarrhea that lasts for weeks to over a month. And sometimes when you have untreated diarrhea, you can become very, very dehydrated, have electrolyte imbalances. In very rare instances with severe dehydration, which again is not super common, in particular in the United States, but say you were to get very, very dehydrated, that could increase the risk of preterm birth just because your body is trying to protect itself. So hydration is key. If you are breastfeeding, Cyclospora does not pass into the breast milk. And again, the biggest concern will be dehydration, which can lower the milk supply. So what is treatment for Cyclospora? Historically, the treatment for Cyclospora is a medication called Bactrim, which is an antibiotic that also has anti-parasitic properties. There is no effective substitute. We typically don't prescribe Bactrim during pregnancy unless the benefit outweighs the risk, there is no suitable alternative, and you've been well. Talk with your doctor if you have concern about Cyclospora. Diagnosis is made via stool sample. And if the diagnosis is certain, again, talk to your doctor to make sure what is safe. If you're breastfeeding, the concern with breastfeeding a baby and being on Bactrim is if your baby has something called G6PD deficiency, or if the baby is extremely premature. But in an otherwise healthy full-term neonate, Bactrim is not an issue for mom. So what sorts of things can you do to reduce your risk during this time when we're all worried about it? Well, the first is to try to avoid known sources. And the reality is we can try to do that, but sometimes it's nearly impossible. So for example, 2 weeks ago, my family of six was on a very, very long road trip to see my family in the Midwest. And we stopped at McDonald's and I accidentally got a snack wrap with iceberg lettuce. Didn't tell them to take it off. I totally forgot. Fortunately, I did not get Cyclospora. However, that being said, you should try to avoid things that have the known contaminated things on them. Second is to wash your hands. And this is especially important if you're caring for a baby and you know that you personally have Cyclospora, but you don't think your baby has it. Make sure you wash your hands really, really well, because remember, the transmission of Cyclospora is fecal oral. So if you have it, you can very easily give it to your baby. You can wear gloves, do things like that. If you get Cyclospora, most likely after being evaluated, you're going to be treated at home unless you're super sick. The doctor's going to tell you, go home, take care of yourself, hydrate, drink some Gatorade, take Tylenol as needed for fever, and come in if you have an issue. So ideally, for a normal pregnancy, you should be drinking about half your body weight in ounces of water daily. So do the math yourself. Make sure you're getting enough to drink. Electrolyte replacement as needed. You can throw some Gatorade packets or some of the all-natural electrolyte beverages in there. And then just really, really, really rest. If you start to contract, if you bleed, if you leak, again, those would be unlikely, but if that happens, have a low threshold to go into labor and delivery and get checked out. If you were seeing me in my office and you came in and you had Cyclospora and we went through conservative treatment at home, I would probably say, hey, let me see you in the third trimester. Let's check the baby's growth and check on the baby's well-being, your fluid level, just to make sure that you didn't have any dehydration from the illness that could affect the baby's growth and the fluid level later in pregnancy. Likelihood of that is low. I am a pretty conservative practitioner, so personally, that's what I would do. You can certainly ask your OB, MFM what they would recommend. So the short story is, guys, if you get Cyclospora, do not freak out. Most likely you're going to be just fine. Take some of the measures that we just discussed to reduce your risk. Make sure you wash your hands. Hydrate, 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 hydrate. If you have any questions about Cyclospora, anything else you'd like to know about, leave a comment for me down below. Please like and subscribe to the channel. Share this with another mama. And until next time, I'll see you in the comments. Take care of yourself.